My best friend keeps falling asleep suddenly during the day, even in the middle of conversations. She says she always feels exhausted, no matter how much sleep she gets. Could this be narcolepsy and how is it diagnosed?
Good question. So in sleep world, the common things we see is obstructive sleep apnea, which is the thing we talked about, insomnia, and rarely more interesting stuff is narcolepsy, right? So it's fascinating how the body reacts. It's almost like your sleep wake cycle, if it's like an on and off switch, and basically you're supposed to switch it off at 9 o'clock or 10 o'clock at night and go to sleep. Your body for some reason is not understanding it and saying, okay, I'm going to switch middle of the day during you're doing something, and then you're switching it off. So typically it's almost those episodes, what she's talking about, what we call as cataplexy, is happening middle of the day doing some sudden emotional change. So laughter actually is the highest uh, 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 factor which kind of can induce cataplexy episodes. So again, other emotions can do the same thing. So what's happening is they're suddenly going into bringing this off switch and jumping into kind of sleep. So basically they induce sleep and go into REM sleep actually, which is the dream sleep. So suddenly they're kind of going into this and then wake up refreshed because they got REM sleep, and then in few hours they can do this again. So what we call as narcolepsy. Narcolepsy is kind of a disease where it's due to excessive daytime sleep. It has excessive daytime sleepiness, and then also have these episodes. There's a couple of different types. So the type 1 is more comes on in teenage, and it be due to genetic problems. So there could be some familial connection, but also we think like there is a autoimmune process. So basically when you're young, you start having some, let's say, some infection, viral infection, and kind of that's killing the chemical which is supposed to be produced, the cells which is supposed to produce that chemical, and that can cause narcolepsy. The chemical we're talking about is called hypocretin or orexin. So it's a chemical which keeps you awake. So because of the low levels of the chemical, which is coming from the brain into the CSF, and basically that stuff causes these acute episodes of cataplexy. So the problem is they're sleepy, and they're having this sudden cataplexy, and then obviously they have significant functional limitation because of these reasons. So you need to treat that appropriately. The narcolepsy 2, type 2 does not have as much of cataplexy episodes. It still causes hypersomnia or excessive daytime sleepiness, but does not cause the same cataplexy episodes. So you could still have narcolepsy without cataplexy.
Thank you so much, doctor.